I'm just begging you, don't cut mental health services.
Lawmakers are told lives are at stake. Don't trim dollars for treatment or medication.
It is real. It is a real illness. It's not just what Aunt Betty has every once in a while when she gets feeling down.
The testimony comes from
our goal is to be sure that that does not happen.
Valerie Mudd. She works for the mental illness support group NAMI Lexington. She herself is bipolar and in recovery for post-traumatic stress disorder triggered by childhood abuse.
I have been diagnosed with something or other for the last 20 years. Since I was 20 years old, I just turned 40. And it's been a long road.
In these tight budget times, just maintaining flatline funding becomes a goal. This is the 874K Coalition Rally. The coalition stands for the 874,000 Kentuckians who have a disability.
And how many of you need help with job training?
Lawmakers are mulling over the idea of using $220 million in Medicaid money to help patch the state's budget holes, hoping new federal stimulus dollars would then refill Medicaid.
We've got some things to talk about.
The governor calls that idea danger on the horizon.
It is crunch time. We do have a terrible budget situation, but we don't need to be balancing this budget on the backs of the most vulnerable people in Kentucky's society.
But even the lawmaker regarded as the most staunch advocate for not cutting human services admits budget cuts are inevitable.
I don't think there's any way that we can, any of us that's working with this budget can say that there's not going to be pain, because there is. There's going to be pain involved.
This rally's message: if you cut mental health services, more people will end up in the hospital, jail, or homeless, some dead by suicide.
Without your head, the rest of the body doesn't work.
At the Capitol, Greg Stotelmyer, ABC 36, your local news source.